Hello everyone, Assalamualaikum. Thank you again for being here. We are on Doctors Go Live on the Columbia Asia Facebook. Today we are going to be talking about something that's very interesting. It's amusing because of the nature of the incident. I'm talking about, you know how kids can be very bored at home and then they get into all kinds of mischief. Some of them may feel experimental and they want to put things in their noses and whatnot, you know, all those funny things lah. But okay, so this may sound funny, but then again, of course, it's considered a medical emergency. So we have with us today to elaborate more on this, Dr. Mohd Adzreil Bakri, who is our ear, nose and throat specialist from Columbia Asia Hospital, Setapak. Hello, doctor. How are you?
Hi, Puan Sakina. I'm fine, thank you.
That's good to know. Okay, before we start, I would like to tell the viewers, if you have any questions pertaining to the topic, you can always put your questions in the comment section below, and then we will get to those questions and doctor can be answering those questions on the spot. Okay, now let's start off with you telling us more about foreign bodies in the ear, nose and throat. Who gets it and why they happen? Basically, if you can just relate to us some of the incidents that you've seen. I'm sure ada yang quite, horrific or, I'm not sure. But, if you can just cerita sikit lah, what are the examples?
Like you said just now, foreign bodies in the ears, nose and throat ni memang interesting. It is interesting and fascinating, why kids put these things in their noses and ears. I mean, by instinct, kids are curious. They are more curious than adults. They are adventurous. Maybe they are bored. Sometimes they play with their friends or their siblings, and they tend to experiment. And interestingly, during this last few weeks, during the movement control order, I've been getting more cases of kids, putting stuff up their noses and ears. Okay, and maybe because more time at home. Bored, cannot play outside, so experiment. Why don't we put something in our ears and noses? Okay, so based on some of the cases that I've seen, there are things that I've removed. For example, things that we generally, we try to differentiate between things which are organic, for example, seeds or beans, and things which are inorganic, macam beads or eraser or pencil, stationery. Okay, so I have a few examples here, which some I've taken out myself, and some are just examples. Okay, organic things such as beans. Okay, green beans, small green beans. They can just put inside their ear. Okay, another bean, another is a peanut. Okay, it's this can easily go inside the nose. Okay, this size.
Yes.
Common things as well. Pieces of paper, pieces of erasers. Okay.
Yeah.
Buttons are very common as well. Okay, small buttons, big buttons. Okay.
Okay.
And pieces of toys such as Lego toys, and I even remove you can see this Batman head, a small Batman head from the nose. Imagine having Batman's head in your nostril.
Is that a souvenir for you from the patient?
Yeah. Yeah, even this one is a long piece of toy which was put inside a kid's nose. Yeah, so it's long, so it slides inside the nose easily. Okay, but not so easy to remove it, because it went quite deep. And plasticine is quite common as well. Plasticine, Play-Doh, cotton wool, tip of cotton bud is very common.
In the ear? In the ear as well?
Yeah, this is in the ear. And last but not least, I would like to show, this is fairly common but very important to note. And
what's that?
Okay, this is a button battery. Okay, a button battery. Like small toys for small lights. A button battery. This is very important because if this is put inside the nose and if not removed within a day, you can get like damage surrounding the structures involved. I mean, in the nose, you can cause perforation of the middle part of the nose, of the septum, okay, and can be a big hole inside, okay.
That sounds very serious, actually.
Yeah, it is serious. Yeah, it is serious.
What you just described, is that exclusive to just the battery, or is it just with any foreign object that you insert in the
Okay, it's a good question. Okay, the battery causes the most damage, okay, because of the chemical reaction, electrolysis, burns, alkali, also acidic burns. Other types of foreign body, for example, the peanut, okay, it can, if it's left long, it's because it's organic foreign body, it can cause reaction to the tissue inside the ear, inside the nose, okay. So organic foreign bodies tend to cause this reaction more. Like if you notice that your child put a plastic foreign body like a button or a bead, okay, these types of foreign bodies, they cause less damage, okay. So in a way, they can be left a bit longer. I mean, not intentionally, they can be left a bit longer, but they do less harm compared to the organic foreign bodies like the peanuts and worst of all, the batteries.
I see. Doctor, how far up, usually, in the cases that you've seen, how far up do these foreign objects travel, or is being inserted by the child? Or does it actually travel once it's inside?
Sure. Okay. So once a child puts the foreign body inside, okay, I'll show the ear first. Okay, I have a model here.
Okay, that's good.
Okay, this is a cross section of the ear. You can see this is the earlobe outside of the ear. Okay, this is ear canal, the ear hole out here.
Right.
And then it goes inside here, the eardrum. Okay. So if a child puts the foreign body in the ear, normally the foreign body will be in the canal. The canal means the saluran telinga lah, yeah? And usually it will be stuck in the middle here, and at most it can go is just before the eardrum. Okay. Yeah. So that's how deep it can go. Normally the eardrums are intact, so it will just be stuck here. Okay, and it won't go any further. Okay.
Yeah, Doctor, can you show the model again? But maybe if you lift it a little bit higher and nearer to the camera.
Okay.
Okay. All right.
Yeah. Ear canal, ear hole.
Right.
Eardrum. Okay. So it can go quite deep in, and usually stuck here. So if it's stuck here or around this area, then it needs to be removed. I mean, normally foreign bodies in the ear is quite difficult for parents to remove themselves, because once it's inside here, then you need a special instrument to remove it.
Yeah. Are there any risk of further injuries if parents should want to try and remove it themselves?
Yeah, of course. I would generally not encourage parents to remove, unless for the ear, unless if you see the foreign body is outside here, just at the entrance, of the ear canal, then maybe you can squeeze the top part of the ear and try to squeeze it out, but never shove anything through inside. Never.
Yeah, or tweezers. I imagine that some of them would like to use tweezers and
it's fine, but again, there's always a risk of pushing the foreign body deeper inside. So preferably I wouldn't advise or recommend doing that. If foreign body here, better you bring the child to see a doctor.
Likewise, the nose also.
Okay, for the nose. Coming back to your question just now, how deep you can go. Okay, for the nose, it's considered even more serious than the ear. Okay, because the nose is from here. Okay, it's the cross section of the head as well. The nose is here. So this nasal cavity, it goes here and until the back here, the back of the nose, and down here is your throat. Okay. Down is the throat, and at the back here is the food pipe, and in the front here is the windpipe. Okay.
All right.
So imagine if your child put something in the nose, okay, and then the thing can basically migrate to the back of the nose, and there's a risk of the foreign body to go down and go into the airway, meaning into the lung. Okay. So this is dangerous. So that's why any foreign body in the nose, if you suspect your child having a foreign body in the nose, you have to bring your child straight to see a doctor. Okay, don't wait.
Okay.
Because there's a risk of aspirating. Aspirating means tercekik atau tersedak the foreign body, which is dangerous, very dangerous.
Once it travels to this area to the windpipe area.
If it goes down, if it goes into the food pipe, it's fine. I mean, tertelan je kan. I mean, you just swallow the foreign body, it's fine. But if it goes into the windpipe, it can cause aspiration. It can cause choking, can cause pneumonia. So, if you suspect a foreign body in the nose, you have to bring your child straight to see a doctor.
So is that the worst case scenario, what you've described?
Yes, worst case scenario, you can choke on the foreign body, can asphyxiate, cekik, then turn blue and sesak nafas and all. So that's dangerous. So
which is not something that happens in the year lah. That's what you said.
Yes, so for the ear, the foreign body will be stuck at the eardrum, or just before the eardrum. Yeah. So
Okay. Is there any need for surgeries?
For surgery.
How does it go? The extent of
it. Let's say you bring your child to see a doctor, and your child has a foreign body inside the nose, for example, and the doctor has seen the child and tried to remove the foreign body, in clinic. For example, I try to do it. I see the foreign body in clinic using my light, and I see there's a foreign body in the nose, and then I try to remove it using some special instruments, like a hook, or some forceps. So I try this first in clinic, provided that the child is cooperative, sits comfortably, doesn't struggle, and in this instance, the cooperation from the parents and the child is very important. So if unfortunately the child struggles, I find it difficult to remove in clinic, then I would suggest to the parents that it has to be done under general anesthesia. So general anesthesia, it's not an operation. It's just like a procedure done under anesthesia. So the same way I would remove it using these instruments, but it's just that the child will be unconscious. Under anesthesia, and that will be done in the operation theater.
I see. Can you give us an example whereby the child is in pain, and then how alleviate the pain, or maybe you can give tips to parents, because this happens obviously at home, and then while getting the child ready to go to the hospital, the child is crying in pain. So what can the parents do in order to reduce the pain a little bit before the doctor?
All right. Normally, when a child has a foreign body in the ears or nose, they won't complain of pain because the foreign body is most of the time is inert, and doesn't cause any pressure effect or pain. So if the child complains of pain, it is a red flag. Parents need to be aware if they complain of pain, or straight away, this could be a foreign body, and the foreign body is causing problem. It's reacting with the surrounding tissues, and it's causing problem. So have to bring to the hospital, see a doctor immediately. And what can be done in between is first of all, try not to be calm, try not to scold the child, try not to shock or surprise the child, because it can make it worse. Reassure the child, saying that all is going to be okay. And also, if the child is very distressed or seems to be in very severe pain, then you can give some Panadol or paracetamol, adjusted to the child's weight, if you know. But if not, straight away bring the child to the hospital. Like I said, pain is a red flag. You shouldn't wait if the child complains of pain.
Okay. Other than the objects that you showed just now, has there been any sharp objects, for example, that has actually ruptured the skin, causing blood? I mean, that would be a very extreme case, I suppose.
Among all these objects, the one which is the most dangerous is the battery, button battery. Even if it's left for a few hours, it can electrolyze. Electrolysis, it can dissolve. It can cause acid leak, alkaline leak, burns, and that can damage the tissues. And when the tissues are damaged, the tissues can sort of like disintegrate, and can cause like a permanent injury and scarring inside the nasal cavity or even ear. Yeah. Yeah. So again, yeah, battery, yeah, big no-no, big red flag. Yeah.
Okay, doctor. Okay, some children when they play with each other and then they do this adventurous thing lah about inserting all these foreign items into their noses or ears. And then they feel stuck and they don't want to tell their parents because takut kena marah kan.
Yeah.
But how would you be able to tell that there is actually something not right with the child if the child chooses to just diam and tahan the sakit?
Yeah, sakit is like usually the end, end of the line lah. So parents should notice a change in behavior of the child. Okay, if let's say the child is usually jovial, usually chatty, and suddenly quiet, kan? Then you should ask, okay, you're right. Is there something wrong? And usually the child will be a bit more quieter and lagi tak nak cakap. So parents should take note of these small changes, in their behavior. Okay. If the foreign body starts to create an impact on the body, then sometimes the foreign body in the ear, child may be like keep on tugging the ear, asyik tarik telinga or do like this, So that's a sign that there might be something inside the ear. Okay, and for the nose, the child might have like sneezing, runny nose. Okay, and foreign body in the nose typically presents with one-sided discharge. I mean, sebelah hidung just keluar air aja, but the other side is okay. Only one side yang discharge, okay. And parents typically think that the child might have sesama, like runny nose or just a common cold, whereas it is a foreign body. So this is a very important sign, like unilateral or one-sided nasal discharge. Yeah? So if that happens in your child, quickly. Or like interrogate, say or ask questions, what happened, and bring him or her to the hospital to get it checked. So these are the signs that they might have. Okay, like worse or later signs, like I said, they might have pain, they might have mucus coming out, but that is quite a later sign. Yeah.
I see. What about some advice for parents if ever this happens to the child and then they're going to bring the child to the hospital? I know that we spoke about how to alleviate the pain, but maybe there are other things that they can do. For example, tuam air suam, air panas or something like that. Is that something that you would recommend?
No, I wouldn't. Okay. If let's say, you suspect the child have something inside your nose, inside the child's nose. And then you just use a light, like a torchlight or your handphone light, lift the child's nose up like this and try to have a look inside, Normally it's quite easy to see, If you see that there's something inside, of course you know that it's a foreign body lah, and if you want to try to remove, don't put anything inside the nose, don't push the foreign body. What you can do, for example, if there's something in the right nose, you close the left nostril, and you ask the child to close the mouth and blow through the nose, blow him or herself through, like that, That might forcefully expel the foreign body, if it's not too deep, But if it's too deep, then try not to do anything else and bring the child to the hospital, For the ear, again, you can use a light and see if you see like something just at the outer part of the ear hole, you can try to use tweezers to remove, but try not to shove anything inside the hole, because it can make the.
And don't knock the headlight. Don't knock the headlight on the other side too.
Yeah,
because it's not water. Some people when they have water, when they shower, and then they tend to do that.
No. Again, if you're not comfortable doing any of this, and I wouldn't really recommend you to do. You just bring the child straight to the hospital. Yeah.
Okay. What happens when the child reaches the hospital? What's the first thing that you will do? What can parents expect?
Okay. If the child comes and see me, I will try to get a history, like what was put in, and also when was the foreign body inserted, just to have an idea. And then see whether the child has any other symptoms like complications of the foreign body, like infection or fever and cough or runny nose, anything like that, sinusitis. And then once I get the history, I'll examine the child, okay, with the light, headlight, or even endoscopes, cameras that put inside the orifices and then projected the image in the monitor, so the parents can see as well what's inside. And then once I know the diagnosis, I try to remove, okay, again, like I said, using special instruments, okay, like a hook, okay, like a right angle hook, and then suction, okay, vacuum suction, and also forceps, okay. I try to do this in the clinic, you know, after reassuring the child and also the parents. Parents
Yeah, because
usually,
they're
yeah,
scary looking instruments.
yeah,
Especially for the child, I think that's tengah
yeah,
sakit.
yeah, scary looking doctor also. So the child might be, yeah, might be scared. So yeah, we have to make sure that they are not traumatized, you know, they are comfortable, they are calm, you know, and then we do all
Yeah.
this. Parents need to hold them, okay, usually in their arms. Then usually they are calmer in that way. And
Yeah.
once they're comfortable, I try to remove it. Try to ideally a single attempt, okay, to remove the foreign body. And I try some more if it still can't be removed. But if very difficult or the child is struggling, you know, crying, in pain, then I would suggest removal under general anesthesia, okay, which requires admission into the hospital, okay, and maybe requires some antibiotics as well if there's any evidence of infection, okay, and once the case is put up, and usually these cases are done on the same day because it's emergency, okay, done on the same day. And then you know, except for the ear, sometimes ear you can wait until the next day, but for nose you have to do it the same day. And then depending on what I see in the operation theater, if the foreign body is removed, if say there's any damage or injury to the skin, to the surrounding areas, you know, that area needs to be washed, okay, properly. And then also maybe I consider to start any antibiotics if there's any sign of infection.
Right.
So that might take like at least 2 days, 1 night admission, okay, or 3 days, 2 nights. But usually it's a one-off thing. Okay, 2 days, 1 night is the most common length of stay in the hospital. Yeah.
All right. Do you have any advice to give parents to prevent their children from from having foreign bodies inserted into the ears and nose?
Yeah, of course. Like everything, prevention is always better than cure. So again, parents always be vigilant. Always see what your kids are up to. Okay. Never leave any small things lying around. You know, small toys, small buttons, small beads, batteries. You know, okay. I mean, I wouldn't know anyone who leaves batteries lying around, but you know, kids, they always tend to be very curious, right? And they very adventurous. So yeah, especially among toddlers, okay, don't leave all these small things lying around, okay, and be very vigilant when your child, you know, have a change in their behavior, or when they have the signs I mentioned just now, you know, ear tugging, pressing the ears, or one-sided discharge in the nose. Straight away, you know, you pick that up and try to see what's the problem.
Okay. Doctor, just now we spoke about foreign items in the nose and also the ears, but maybe you can touch a little bit about the throat, which obviously is choking, right?
Yeah. Okay. Foreign body in the throat is fairly common as well, and most commonly is because of food. Okay. Common things such as fish bone can easily be stuck at, for example, at the tonsils or at the tongue base. Okay, you show again. Okay, this is the area of the tonsils. Okay, so foreign bodies in the throat can be easily stuck here. Fish bone in particular. Okay, and then when the foreign body is stuck here, the child or patient will usually show the pain up here. They feel something stuck up here. Okay, and if the foreign body goes even a bit lower down to the opening of the food pipe, which is here, okay, they usually complain the pain or discomfort down here in the throat. Okay, so this can happen as well. Again, foreign bodies of the throat require like vigilance from the parents' point of view. A child who have a foreign body stuck in the throat will have difficulty or painful swallowing. Okay, they will have sometimes if it's prolonged, they can have fever. Okay, and they can have drooling as well, drooling of saliva, difficulty to swallow. So if your child has any of this, be vigilant, be alert of that, and take note. Okay, and just ask what's causing the discomfort or problem. Okay, and if you suspect there's a fishbone stuck, try to let your child drink some water first. Okay, sips of water, and maybe that can that can cause some relief. Dislodge the bone and go down. And try to take like pieces of food or rice that might stick to the foreign body and let it swallow down. Okay, but if all that fails, okay, bring your child to see a doctor. Okay, most of the times the foreign body or the fishbone is stuck at the tonsil. Okay, that one is just requires light and tongue depressor. I will have a look, and if you see the foreign body is there, you can just quickly take it out with forceps. Okay, you can quickly take it out with forceps. But if you can't see the foreign body, and sometimes children, they are not cooperative, to open their mouth, and they might be in distress. So if you can't see the foreign body in clinic, and if the history and clinically is very suggestive, okay, you might need to admit the child and do an examination under general anesthesia.
Okay.
In the operation theater. Yeah.
Okay. Right.
Yeah.
Sorry.
I would say foreign bodies of the throat is a bit more tricky, especially in children, because quite difficult to get them to open their mouth, and quite difficult to put a scope inside their mouth. Yeah, to put a camera inside their mouth or nose for that matter. Yeah, so it's even more tricky.
Do you have adult patients who come and see you with things stuck in their noses and their ears as well? Because that generally would be something that children would do.
For adults, foreign bodies of the throat is more common.
Yes, of course.
Yeah, food particles. Yeah, bone, fish bone, chicken bone, beef bone, pork bone. Yeah, crab claws.
Wow, sounds painful.
Yes. So for adults, fairly common for foreign body throat because of the food. Okay, but for kids, it's not that common. And for adults, the nose, foreign body for the nose and ears, less common compared to the kids.
I see. Okay, doctor, we've got a question here from Ms. Dalia Al-Katiri. How about if an insect goes into the ear?
Oh, okay. That's a very good question.
Yeah.
Common, but not as common as the other foreign bodies that I showed just now. Okay. If you suspect there's an insect that in the ear, for example, like a fly, okay, or an ant, okay, or a small cockroach, okay. So don't panic, okay. So
I can start making.
Okay. But something has to be done. Okay. First of all, we have to kill the insect or disable the insect, the living thing, okay, by putting oil. Okay. What kind of oil we can use is like we can use baby oil, we can use olive oil. Okay. So this oil will basically drown the insect. Okay. And once the insect is dead, then you won't feel it moving. Okay, it becomes inert. Okay, but again, once it's dead, it's easier. You have to go and see a doctor to get it removed. And once it's dead, it's easier for the doctor to remove it. Okay, because you don't want a live insect in your ear or in your nose, and then when you see the doctor will be struggling to remove it because it's moving about. So you have to kill it first. Yeah.
How much oil are we talking about for you to be able to drown the insect?
How much oil? Okay, a few drops, maybe 3-4 drops. How you do it? You just put the drops inside the ear hole. Okay, just put it in. Then once the drops are in, you just massage the front, this part of the ear, so that so that the drops go in, okay, and then just leave it, okay, and then I would say go and see the doctor, you know, the next day or straight away go to have it inspected and removed. Yeah.
But never spray insect repellent into the ear lah. Anything like that.
Yeah,
Because some people, I guess, maybe that could be the obvious solution.
Yeah,
just spray it into the ear, but no.
Yeah. Yeah. No, I wouldn't recommend that. Yeah, because you know you might do more harm than good. Yeah, because it's poison, right? You might do more harm to your ear than
Yeah, this might be an amusing topic, but not to those who are actually suffering when they come and see you with all these problems. Okay, let's see if we have any more questions. It doesn't look like it, doctor. So it's fine, because sometimes the questions tend to come after the program over. So we will always forward to you the questions, and then maybe you can provide the answers later on.
No problem. Yeah, I'll be
so thank you so much for your time, Dr. Mohd Adzreil Bakri from Columbia Hospital, Setapak. He's the ear, nose and throat specialist. And yes, well, selamat berpuasa, and thank you to everyone who has joined us in this program. We'll see you again. Thank you.
Thank you. Bye.